Talk about really about process and how to go about considering whether or not you want to do outpatient total joints in your ambulatory surgery center, and if you do decide to, what's the process? A lot about how and what. So today's objectives, we're going to review current trends in outpatient total joint replacement, why this shift is occurring. We're going to look at the challenges and the opportunities and the advantages of providing arthroplasty surgery in the outpatient setting. We're going to help you understand the process, patient selection criteria, some examples there, and the implementation steps required to successfully perform outpatient hip and knee replacements. We're going to go over some of the pre-op, perioperative, and post-op protocols. I'm not going to go into a lot of great detail. I think you heard some of the other speakers speak to those in today's presentation, because I'm going to really focus on process. And then we're going to review the clinical, the financial models that are coming forward, the bundled payments, particularly around total joints. Well, we all know that outpatient delivery systems and the reimbursement models in particular are changing pretty rapidly. So these procedures are moving very quickly to the ambulatory settings. In some markets, we're seeing a very quick movement. In other markets, a little bit slower, and we'll talk about some of the dynamics that are driving that. But from a show of hands today, how many of you are already doing total joints in your outpatient setting? Okay, great. And have you been doing those for quite some time? Or?
I've been doing the UED for about 4 years.
Okay.
And we just opened up our anterior hip.
Excellent, good. And how many of you are considering it or are in the thinking about it? And how many of you are in the active planning stages? Oh, good, good. So we've got a good mix today. Well, some of the other drivers are high expectations of our baby boomers. We know that this is an elective procedure. We know that patients are not afraid to travel hundreds of miles, even across state lines, to go to destination centers of excellence where they perceive a higher quality of care, a great patient experience. We see patients traveling from Chicago to San Diego. We see patients from Seattle going to San Francisco. So we see a lot of movement, and some of that is also driven by the payers. We know that with the networks like Walmart has, they're sending patients across state lines. So being cognizant of that as you design and implement your program. New technology is certainly a big driver, the minimally invasive, partial knee replacements, the advancements in pain control with the multimodals and the short-acting spinal approaches are certainly promoting earlier ambulation for those patients, that they can get up quicker, can recover faster, and can go home safer. We also see some of the co-management models and the bundled payment models, the co-management more on the inpatient side, or if the ASC is owned by the hospital, and the bundled payments starting to emerge. So we're starting to do a lot more work along those lines. And you can see on the left-hand side of the graph there that if you look at all payers, a projection for outpatient joint replacements is expected to grow pretty substantially. You can see 15.4% on the outpatient versus 22% on the spine services. And on the right-hand side, you can see the growth by sub-key product lines, spine, injections, sports medicine, et cetera. But overall, you can see that the expected 5-year growth of outpatient joints is at 157% as projected by the advisory board, which translates to 169,000 procedures on the outpatient side in 2018. We take a quick look at the age distribution, not to spend a lot of time here, but you can see the distribution for total hips and total knees by male and female, and we all know that the age is getting younger. The distribution is shifting, patients are getting younger, and that's again feeding into some of those higher expectations of the baby boomers. Insurance companies, we heard this morning from the keynote that certainly in some markets the payers are pushing ambulatory outpatient total joints to the ambulatory setting, primarily around cost effectiveness, rather than keeping them in the hospital systems. And more and more orthopedic surgeons are training on the minimally invasive approaches and these techniques during their fellowship.